Okay, hey, my name is Meg Graham, and today I'm going to talk to you about erythrocyte disorders. But before we get started on that, I got to go back and add something that I forgot on my last lecture on erythrocytes. We didn't talk about carbon dioxide transport. I said that most of it did not occur on the red blood cell. So actually only about 20% of it occurs on the red blood cell. And it does attach to the hemoglobin, but it just doesn't attach to that iron molecule like oxygen does. It attaches to the protein part or the globin part of that hemoglobin. And when the carbon dioxide attaches to hemoglobin, you call it carbaminohemoglobin, okay? The other 80% of CO2 is going to combine with water to form something known as carbonic acid. Carbonic acid, remember, is going to be dissolved in your blood. It's going to change the pH of your blood because it is a weak acid, so that's going to affect the homeostatic ranges of the pH in the blood, so you got to be careful with that. But you'll learn more about that later on. Okay? Let's look a little bit now. We're going to start talking about erythrocytes, and let's look at the design of erythrocytes. We said before they're basically just a bag of hemoglobin. Well, and they're designed to squeeze through all the tiny little vessels throughout all the tissues. So you've got the smallest vessels, those capillaries, is where gas exchange actually occurs. And so these have to really squeeze through all these little tiny spots. Well, they've got to be pliable and flexible, and they've got to kind of roll around and get through all these spaces. So you have a special protein in red blood cells in their membrane. It's called spectrum. So spectrum is a special membrane protein, and that it causes some cross-linking of the molecules, and that gives these red blood cells their flexibility so that they can squeeze through all the little tiny spots without rupturing, because if they ruptured, they would do you no good. So that spectrum is that membrane protein that helps them squeeze through the tiny vessels, the capillaries. Okay? I've put up here some normal serum hemoglobin values just for your reference. You don't have to memorize these. Notice that males tend to have a little more hemoglobin than females. This is just a reference point. Anything that would be outside of this value would be considered abnormal, and that would give you an indication that there's some sort of disease process going on. And we'll look at some of those disease processes in just a minute. Note also here, too, that we're talking about reticulocytes. I haven't mentioned reticulocytes before, but basically these are immature red blood cells that have not extruded or have not spit out all of their organelles. Remember, when the red blood cell's forming, it spits out its nucleus and most of its organelles, so that all you're left with is a little bag of hemoglobin. Well, if your body senses the need for more oxygen carrying capacity, sometimes it's going to start spitting out red blood cells before they're really mature. And that's what you call these reticulocytes. They're just immature in the sense that they haven't spit out all of their organelles. They're not quite ready to work, but if you have a lot of those, that's an indication that something's going on that you need to look into. Some of the more common things that you can get changes in serum hemoglobin values would just be something like dehydration. What does that mean? It means dehydrated. You have less water. Well, if you have less water in your blood, then per milliliter of blood, you're going to actually have more cells. It's not really that you've made more cells, it's just that you've not diluted out the cells the way you normally do. So you could get a case of somebody who's been throwing up for having diarrhea or something like that, and they're dehydrated, and they would actually show a high hemoglobin value. Another one that you can come across, hopefully you won't come across though, is polycythemia vera. That is cancer of the bone marrow. And in polycythemia vera, you're going to have excess blood cell production of all the different lines. You're going to have excess white blood cells, red blood cells, platelets, everything. But it's the red blood cell production that actually tends to cause the most problems, because it starts making your blood very thick and viscous, and then it's sluggish and it's not doing its job. And so that's usually the one that triggers or gives you a sign that we've got some issues going on here. Another thing you can have is called secondary polycythemia. In secondary polycythemia, that's basically just where you have an excess production of red blood cells. You've got different things that can cause it. We talked in the last video about just living at high altitudes, how your body has to adjust for the lower oxygen pressure in the air, and so it starts creating more red blood cells to give you more oxygen carrying capacity. That's one reason athletes train at high altitudes. The Olympic Training Center is in Colorado Springs. You're at a high altitude, so that automatically is going to give them more red blood cell capacity and more actually more red blood cells, but more oxygen carrying capacity. So along the lines with athletic training at high altitudes, if you notice that marathon runners tend to come from Kenya. Well, Kenya is most of the countries at a high altitude. You've got Mount Kilimanjaro, the highest peak in Africa there. And so those runners are really well adapted to running at lower altitudes, and it gives them an advantage. Something else that you might find is called blood doping. Now, blood doping is not exactly ethical, and it's you can get thrown out of the Olympics for that. But what happens in blood doping, the runner or the athlete or whatever will take their red blood cells out of their own body, remove them, build up some more red blood cells naturally, and then right before the race or the competition, they'll give themselves their red blood cells back. So now all of a sudden they've got lots of red blood cells. You can't track it because it's their own red blood cells. But this is really kind of stupid because what happens with blood doping, you have a high risk of stroke and heart attack because you've now got this very viscous blood. So it's not all about the win, but these people seem to think it is. I guess they want those $1 million contracts for selling underwear or tennis shoes, I guess. But it's a dangerous thing, and you really shouldn't do it. Another thing that can cause secondary polycythemia is hypoxia of the kidney and problems with your heart. Anytime you have decreased oxygen concentration in your tissues, you're going to cause more red blood cell production. That erythropoietin, that whole cycle will get going and cause you to make more red blood cells. So the kidneys especially are sensitive to oxygen concentration, so if they're not getting enough oxygen, then they're going to definitely start increasing the red blood cell production. Remember, we call that erythropoiesis. Okay. One more thing you can have is transient polycythemia. This is when you're in a short-term stressful situation and you get a big adrenaline rush. Well, adrenaline is nothing more than epinephrine. Epinephrine is going to cause your spleen to actually contract. So you're going to get this short-term contraction of the spleen. Well, remember we said that the spleen filtered all the red blood cells and pulled out all the old ones that weren't useful. Well, if all of a sudden that spleen contracts and squeezes out all those red blood cells that are in there for processing, then you've just upped your red blood cell count in your circulation. So it's a short-term kind of burst of red blood cells in your blood circulation. This is real important for like horse races. Like when the horse hears that bell open and the gates open, they get that adrenaline rush, and you get that just big push of epinephrine. And that will cause the horse's spleen to contract and release those red blood cells. I don't know that we're in too many horse races, so it doesn't really matter. But if we get into a stressful situation, it does the same thing for us. All right, you also can have some problems with your tissue oxygenation that I just wanted to mention some of these terms that we haven't covered. The first one is called cyanosis. The term cyan means blue. And so think about, let's say you're choking, and you go, oh, she's choking, and you're gagging over there, and it's like, oh, she's turning blue. Well, you really are turning blue, because what happens is you get more deoxyhemoglobin. Remember that deoxyhemoglobin is hemoglobin without oxygen, and that's going to get a dark, ruddy color, and that's going to cause your skin to take on a bluish appearance. So you literally do turn blue when you're choking, but it's because of the pigments in the hemoglobin that are being changed due to the lack of oxygen. You also have something known as carboxyhemoglobin, and that's when hemoglobin gets saturated with carbon monoxide instead of oxygen. Okay? Now, I know you've all heard of carbon monoxide poisoning. You get it from fumes from like your car exhaust or, gas heaters or things like that aren't well ventilated. Basically, what happens in carbon monoxide poisoning, carbon monoxide has a 200 times greater affinity for hemoglobin than oxygen. So if you put oxygen over here and carbon dioxide over here, 200 times more of this carbon dioxide are going to get onto your hemoglobin molecule, and oxygen gets left out. So if if oxygen gets left out, then you're not delivering oxygen to your tissues, and so your tissues will starve. So if you have somebody who's suffering from carboxyhemoglobin or carbon monoxide poisoning, what's the treatment? Well, you just simply oversaturate them with oxygen. Remember, it's a competitive thing here. So if you put more oxygen molecules out there, then it's more likely that the oxygen is going to get on the hemoglobin and less likely that the carbon monoxide will get on there. So you can reverse it if you can get things switched before you have actual tissue damage. Another thing that you'll hear about is fetal hemoglobin. Hopefully I don't have to tell you what fetal hemoglobin is. The name says it all. It's the hemoglobin that you would find in a fetus. Well, it turns out that fetal hemoglobin has a much greater affinity for oxygen than maternal or the mother's hemoglobin. So if you're pregnant and you're in a stressful situation and you're not getting enough oxygen, the baby or the fetus is going to get the oxygen preferentially over the mother because fetal hemoglobin has a greater affinity for that oxygen. Okay? All right. When you're making hemoglobin, you've got specific dietary needs that we mentioned, and I just want to kind of go through these and show you what happens if you don't have the right dietary needs to make hemoglobin. So let's start by talking about iron. Your body stores most of its iron in hemoglobin, like 65% of it is tied up in this hemoglobin. You have daily losses of iron, though, that are going to occur through your feces, urine, sweat. You just naturally lose some of your iron, so you're going to need to replace it with dietary intake of iron. Women will need much more iron than males because women have a monthly menstrual cycle and they lose blood and therefore they lose more hemoglobin, more iron. And so they're going to need more iron than males. If you have an iron problem, then you get something known as iron deficiency anemia. Now, this could be caused due to an excessive loss of iron. So if you have a lot of blood loss or something like that, you're losing too much iron. It could be caused by an inadequate intake. So if you have a poor diet and you're not taking in enough iron, then you could have iron deficiency anemia. Or it might be caused by poor absorption of iron. You're eating as much as you should eat, but you're not absorbing it well. So you can get different causes for this iron deficiency anemia. The problem is all of these, no matter what the cause, are going to result in what are known as microcytic. Let me write that on here. Oops. Those are microcytic, that's an R, I can't write. Microcytic red blood cells. Now, microcytic red blood cells are like the name says. Micro, they're small cells. So they're smaller, they contain less hemoglobin. They're pale because they lack that red pigment from the hemoglobin. And they don't do their job as well. So the simple treatment, though, is take iron supplements, get more iron in your body, and then you don't have this iron deficiency anemia. All right, another dietary need that you definitely have to watch out for is vitamin B12. It is absolutely necessary for DNA synthesis. And you say, well, red blood cells don't have a nucleus, so why does that matter? Well, remember when red blood cells are forming, what's one of the main things they're doing? They're making proteins. Well, DNA makes the proteins. So if you don't have the right DNA, you can't make the right proteins. If you can't make the right proteins, you cannot make hemoglobin. So you can't make a good red blood cell unless you have enough vitamin B12. Now, where do you get B12 from? Well, it comes from meat, fish, dairy products. People that tend to have a deficiency of it in their diet would be vegetarians. They just don't get enough vitamin B12 from plants. There's very few plant sources of vitamin B12. So you have to get it in more of a meat or dairy sense, and if you're strict vegetarian, you're not going to get it through your diet. So vegetarians tend to be prone to having vitamin B12 deficiencies. But there's also people that get plenty of vitamin B12 in their diet, and they still have what's known as pernicious anemia. So it's not that they don't have enough vitamin B12 in their diet, but what happens is they're lacking intrinsic factor. This intrinsic factor is found in your gastric mucosa, so the lining of your stomach. And it's secreted, and then it combines with the vitamin B12, and then you can absorb the vitamin B12. If you don't have intrinsic factor, then you can't absorb vitamin B12. So you may be getting plenty of vitamin B12 in your diet, and it's just going right through you because you don't have enough intrinsic factor. And you say, oh, okay, well, how would we treat that? Well, we'll just take more vitamin B12. No, that's not going to work because you still can't absorb it. You've got to go bypass that absorption route. And so what you do for the treatment of people with pernicious anemia is you give them vitamin B12 shots. Then it goes right into the bloodstream. You don't have to absorb it through the gastric mucosa. You don't need that intrinsic factor, and you can kind of bypass that route. So if you have pernicious anemia where you lack intrinsic factor, you just take vitamin B12 shots, and then that takes care of everything. If you do have pernicious anemia, though, it's going to result in something known as macrocytes. Well, again, the name says it all. These are going to be big red blood cells. They're big, they're pale, they have very little hemoglobin in them, and little ability to transport oxygen. So they're very dysfunctional. So you've got to get that vitamin B12 injection and bypass all that intrinsic factor problem and get the vitamin B12 in your body. All right, next thing. You've got some other anemias here that I just want to run through real quick. The first one is called hemorrhagic anemia. Hemorrhagic means hemorrhage. So this is going to be an anemia caused by a hemorrhage. Now, you can get a hemorrhage from like a shark bite, or you saw your leg off with a chainsaw. I'm kind of getting a little evil here today, but a lot of people don't have these big catastrophic events in their lives, and they still have hemorrhagic anemia. If you're a person who has an ulcer, a stomach ulcer, or a gastric ulcer, sometimes those can break through the lining of your stomach and they start to bleed. And you don't even realize you have this blood loss going on, but you're hemorrhaging internally, slowly over time, and you're losing red blood cells, and so you start having this hemorrhagic anemia. Well, of course, the treatment for that is immediately you're going to have to give the patient some packed red cells so they can increase their red cell volume instantaneously if it's bad, but you also want to repair the ulcer. Now, remember we talked yesterday, or in the last video, I talked about the color of feces. This is another case where you can look at the color of feces and get an indication that something is wrong. And no, I don't have a feces fetish. It's just, you know, things are designed so you can figure out when something's the matter. But if you have dark, tarry, like like roofing tar stools that are really dark, that's an indication that you're getting blood somewhere in your intestinal tract, and that could be caused by could be caused by a gastric ulcer that's bleeding and causing problems. So you definitely need to check that out. All right, another one is hemolytic anemia. Now, hemolytic anemia is when the red blood cells are going to prematurely rupture. Okay. There are different causes for this. You can have parasitic infections like malaria can cause the red blood cells to just blow up, and if they blow up, they're really of no value to you. But that's when they blow up, we just call that rupturing or lysis. Another thing that you'll hear about is like the Ebola virus, that African virus that everybody was, I don't know, about 5 years ago, it seemed like they always had these horror movies about the Ebola virus. But basically that can cause premature rupturing of your red blood cell membranes. And again, you're going to have some issues there. The treatment for that is going to depend on the exact cause. You might, if it's a bacterial thing, you could take antibiotics, or if it's a viral thing, you're going to have to go different routes. So you just have to see what the exact cause is before you can get the exact treatment. Another anemia that you can have is called aplastic anemia. And that's where you have complete destruction of your bone marrow. Now, this can be caused by drugs. It can be caused by radiation, chemicals, different things like that. Commonly, or the medical professionals will cause aplastic anemia, in a sense, when they destroy somebody's bone marrow that's cancerous. So in preparation for a bone marrow transplant, you want to get rid of all the old, yucky, not usable bone marrow, so you just fry it with radiation and or drugs, and then the patient is left with no ability to produce blood cells. So you give them a bone marrow transplant, and then they can hopefully start building up and producing healthy blood cells. Sometimes along with those bone marrow transplants, you're going to have to do blood transfusions to get them through the hump when they're, completely without. But that is often something that we induce in people, not necessarily something that they catch. Finally, you've got a couple genetic anemias that I want to talk about. The first one is called thalassemia. And this is a genetic disease that's common in Greek people and people who live around the Mediterranean Sea. And then there's some in Southeast Asia, some of those countries like Turkey and places over there, they will have this. As I said, it's genetic. You inherit it. And what happens with these thalassemias, and there's very different kinds, it's a failure to make one of those 4 globin chains, one of those 4 protein chains of the hemoglobin. Well, if you don't make one of them right, it's going to result in very delicate red blood cells that are hemoglobin deficient because you don't have that hemoglobin being made properly because one of those chains is not working right. Your treatment for that is then going to be blood transfusions because you're not making the cells the way they should be made, and specifically you're not making that hemoglobin the way it should be made. Another genetic disease or genetic anemia is sickle cell anemia, and I don't want to talk a whole lot about this because there's a case study that you'll probably be required to do. But basically, in sickle cell anemia, it's the production of abnormal red blood cells due to an amino acid substitution in some of the chains of that hemoglobin, the globin part of that hemoglobin. And you'll learn more about that later on. But basically what happens is these hemoglobin chains don't work right, and they form rods, and those rods cause that red blood cell that's normally of this biconcave disc shape, they cause it to kind of turn into a sickle shape like that. Well, a sickle is not going to go through a little tiny capillary very easily, and what happens is you'll start getting log jams of these sickled cells, and so it's going to plug up these small tiny vessels, and so anything that's trying to get past here can't because you have these sickled red blood cells that plug up the circulation. So everything beyond here is going to become oxygen deficient, and it's going to start to die and be destroyed, and when that starts happening, you have a lot of pain associated with that. So this is a very painful disease, and the patients get into what's known as a sickle cell crisis, where it just kind of gets into this bad cycle. It's like, okay, this part's not getting enough oxygen over here. Well, it turns out that the stimulus for causing these cells to sickle in the first place is a lack of oxygen. So now you've got less oxygen here, so that's going to cause more cells to sickle, and you're just going to get this, circular, bad, spiraling down path of a sickle cell crisis. There are not any really standard treatment right now for sickle cell anemia. They've worked with trying to use fetal hemoglobin for some of these patients because fetal hemoglobin won't sickle. So if you can get the patient to start creating their own fetal hemoglobin, if you can get those genes turned on, then the patient has a better chance of not having problems. You can also block the ion channels in the red blood cell membrane. If you do that, then the ions are not going to flow out, and that red blood cell is going to stay nice and plump, because if you have an ion inside the red blood cell membrane, it's going to take water with it. So that red blood cell now stays nice and fat and plump, and it kind of keeps it from sickling. So that kind of prevents the problem. And then another thing that you can do is give the patient nitric oxide. Nitric oxide causes blood vessels to dilate. So if you open up the blood vessels, even these sickle-shaped cells will be able to get through these tiny passages. All right, well, that's enough for anemias today.